At the World Health Summit, warnings that efforts by global institutions to fight emerging threats are still too weak. This comes in the wake of the Ebola epidemic, where the World Health Organization was criticized for its slow response. But as Guy Henderson reports, as delegates look forward, WHO's chief has come out fighting.
The setting could hardly be more relaxed. But beneath the welcoming smiles, the 2,000 participants gathering for the World Health Summit in Berlin have much to ponder. In the wake of the Ebola crisis, serious concerns remain.
Isn't it your responsibility, Dr. Chan, to step down before the end of your second term in order to signal to the world that your organization, your ship, is sinking?
The World Health Organization says it needs more help.
Countries are very good in making promises, and they do not honor their commitment. If I tell you, WHO as an organization, only 30% of my budget is predictable funds. Other 70% I have to take ahead and go around the world to beg for money. And when they give us the money, they are highly linked to their preferences.
New challenges are emerging. The growing mass movement of migrants and refugees is a key discussion point here. Is the world ready to deal with the health implications? The summit's founder says not yet.
We all know that we have a very strong, very important organization like WHO. But we also know that WHO has not been able to cope with a problem like Ebola. So these organizations have to be strengthened. They are also kind of restricted in their scope of action by their constitution. They're a member of the UN family, so they have certain things they can do, other things they cannot do.
It is my honor and my pleasure.
This is one of the most important health forums on the international calendar. Governments take note of its recommendations, and on day one, a prevalent theme is already emerging.
The mandate of these summits is to look ahead, of course, but it's the focus of last year's gathering, the Ebola virus, which continues to cast a long shadow. That pandemic exposed deep weaknesses in global health systems that many here feel still hasn't been fully addressed and could continue to hamper efforts to tackle the next big global health challenge. Guy Henderson, CCTV, Berlin.